28-year-old man comes to the physician with flank pain and hematuria. Physical exam reveals costovertebral angle tenderness. He has a history of Zollinger-Ellison syndrome caused by a pancreatic tumor, which was treated with surgical resection. Which of the following junction is most likely to have an abnormality on a radiologic scan of this patient? Choice A, between the major and minor calyces. Choice B, major calyx and renal pelvis. Choice C, proximal middle third of ureter. Choice D, middle and distal third of ureter. Or choice E, bladder and urethra. I'll wait 5 seconds and answer the question. So this patient obviously has nephrolithiasis, pretty easy diagnosis here. He also most likely has multiple endocrine neoplasia type 1 because he has this history of a gastrinoma. Not important to answering the question, I just threw it in here because I like doing that for you to see MEN more often. Anyway, the basic question being asked of you here is pretty much, where does the ureter narrow? And you just gotta memorize it. You gotta know that there's 3 areas where the ureter tends to narrow and you can easily lodge something like a kidney stone. First one is the uretopelvic junction at the kidney. The second one is the pelvic brim where the ureter crosses the common iliac artery. And this is located at choice D, middle and distal third of the ureter. And then finally, the third one is at the ureteral vesicle junction. In other words, where the ureter enters the bladder. Straightforward anatomy stuff, shouldn't be hard. Let's just look at some of these wrong answer choices here. Choice A and B, major minor calyces and major calyx into renal pelvis. This is describing the collecting system, right? You are generally speaking not going to lodge a stone in there. The only technical exception to this, if you want to count it as one, is if you have struvite stones, like from an infection with a urease positive organism like Proteus or something. The staghorn calculi that get formed inside the collecting system. So technically, I guess you're kind of obstructing these areas, but I don't think they would ever ask a question like that. Choice C, proximal middle third of ureter. The most notable structure that crosses around here is the water under the bridge, gonadal vessels. It is potentially possible for gonadal vessels to cause a narrowing of the ureter. It's pretty atypical and wouldn't be considered one of the common sites. Finally, choice E, bladder and urethra. It's pretty rare to get an obstruction once you enter urethra. So bring it back, it's just a basic anatomy question, right? Just remember your 3 narrowings of your ureter. First one is renal pelvis into the ureter, so where you enter the ureter essentially. Second one is where the ureter exits into the bladder. And then the third one is found between the middle and distal third of the ureter, because this is where your ureter crosses the common iliac artery. Hope you found this video helpful. I'll see you in the next one.